taken any form of medicine before. And please pardon me if I interchange medicine and drug, okay? So if I say drug, I mean medicine, as our sister rightfully said. We don't mean the hard one. But even those ones, some can be used as medicines, actually. So we'll differentiate the two. So anyone who hasn't taken any medicine before? Okay, so we agree that we've all taken medicines before. So what is medicine? What is medicine? Any idea? When we say medicine, what do we mean by medicine? Anyone? As I said today, I'll even come down here. It's going to be more interactive and then, yeah. So medicine, any idea what medicine is? Anything, like we are not right or wrong, we are all learning, okay? Yes, sister.
I'll say medicine is an antidote that can be used to cure a sickness or a problem.
Okay, so medicine is an antidote we use to cure a sickness or a problem. Anyone else? Okay, so our sister is she's right. So medicine is anything that we take in our body that changes the normal functioning of our body. Are we okay? So medicine, we can take medicine for three main reasons. Okay, so we take medicine to cure diseases when we are sick. We take medicines to prevent getting sick or prevent diseases. And then sometimes we take medicines to even help diagnose the disease. When we say diagnose, please draw my attention if I'm using big words that we don't understand. But we all understand diagnose, right? Yes, when the doctor wants to find out what is wrong with you, sometimes you are given some sort of medicines to help diagnose. Sometimes some people are going through some procedures like surgery, and then they will be given medicine to help empty their bowels so that the doctor can take a scan and then see whatever is wrong. So all those are functions of medicine. So we've established that medicine changes or corrects something in us when we take it. Now, the issue of drug and medicine comes to mind. So actually, this definition is for drug. So drug is anything you take to change your physiological being, right? And then medicine is the one that has a positive effect. Do you understand? Do we get the difference? So drug, like the Naope and all the other hard drugs, okay? When one takes those drugs, it changes how we function normally, right? But mostly it's for the negative, okay, or bad results. But for medicine, we take it for beneficial results. Are we okay? Okay, so medicine, we've said that medicines are good, and then they give us good results at the end of the day. How many of us have taken medicine and experienced something else aside what the drug was or the medicine was meant for? How many of us? Okay. And any idea what we call those other effects that we experience when we take medicines? Sometimes. Side effects. You see, we are very smart. Let's do it for ourselves here. It's a very smart class. So side effects, right? So the next thing I want us to establish is that every medicine is a potential poison. I didn't say every medicine is a poison. It's a potential what? Poison. The difference is what? How much you take. Okay? Every medicine is a potential poison. The difference is how much you take at a particular point in time. Okay? So we call that dose. So I like Panadol a lot. It's the simplest drug that we can or relate to, okay? So Panadol, mostly how many Panadol tablets do we take? 2, right? So, how many of us know how much is in one tablet? Any of us? How many milligrams? 500 milligrams, good. So each Panadol tablet is 500 milligrams. We take 2, that is 1,000 milligrams or 1 gram, right? So that 1 gram that you take at that particular point in time is the dose, okay? And then you take it mostly 3 times a day, or in other conditions, you can be told to take it every 6 hourly or even 4 hourly, depending on the condition, okay? But there's something we call daily maximum amount. In a day, there is a maximum amount of Panadol that you can take, okay? That will not be harmful to your body, okay? How many of us know that Panadol can kill? Okay, so Panadol can kill. There are people who have committed suicide with Panadol. Okay, so what happens is that every medicine, when we take it, we have different types of medicine. Let's also Panadol. Now, those with babies, Mama will tell you that she gives baby Josiah Panadol syrup, right? And then we take the Panadol tablet, right? And then there are some that you put in the bonbon. Ivan will tell you that, Mommy, I like the medicine you put in the bonbon. You get it because it's easier. It's all Panadol, right? Now, when these drugs are taken or medicines are taken, our body processes it, okay? And then it eliminates them, okay? Now, the liver is one organ that is responsible for most metabolism. When I say metabolism, I mean breakdown. Okay, so let me also state that every medicine is a chemical. Okay, so they are chemical entities. So when we take it, it's broken down, the blood absorbs it, and then it goes through circulation. It does what it's supposed to do. When it finishes, there are other organs that does metabolism, but the liver is the primary organ that does what? Metabolism, or breaks down these drugs. And then the kidney is the one that what excretes it or helps us to get rid of it. Okay, so how many of us have taken drugs that we pee and the color of our urine changes? Yes, if we've experienced that before, it's the drugs, the metabolites, the end product, okay, being excreted. So the liver is responsible for most metabolism. So if you overwork the liver, then you are giving the liver problems. You get it. I remember my auntie lost a very good friend, and she was so down and she was so devastated, and she keeps saying that comfort, she used to take medicines a lot, she's unlike me, and then I wonder why she died. And I told my auntie that maybe it's the medicines that she kept taking that even killed her. Okay, because she was just taking anything. So Panadol is one drug that can cause liver toxicity when it is taken in high doses, okay? So it can cause the liver to shut down, and then the patient can pass, okay? And then the kidneys, okay? We said that the kidneys are responsible for taking out the drugs after they've done what they are supposed to do, and then they are excreted. So if we take too much when we are not supposed to, we put a lot of pressure on the kidneys, okay? In recent times, there's a lot of issues with what? Kidney problems, right? And then it's some as a result of self-medications and things we are not supposed to take in excess, or in doses that we are not supposed to take, causing the kidneys to be what? Overloaded. So in most patients with those conditions, like kidney conditions, like liver conditions, even the dose or how much, so we've explained dose, right? Dose is how much you are taking at a time. Mostly the dose is adjusted or is even reduced so that the kidneys can cater for it, and then the liver can also cater for it without being a problem. I don't know if I should finish before we ask questions, or we can ask questions as we go. Okay, let me finish. Okay. So we've established what medicines are, and then we have to take them prudently. So somebody will ask, how is it determined that I take this medicine when I take the first dose, and then after like 4 hours, 6 hours, 10 hours, I take the second one? And then what happens when I miss my dose? Okay, the time I'm supposed to take it, and then I miss it. So every drug, when it's taken, okay, we have something we call onset of action, when it will start working. Okay, so when you take Panadol tablet, okay, you see that tablet is hard. If you are like me, myself and my career, we are paralyzed. We never meet. I don't like taking medicines. So if you are like me, I break the Panadol. Okay, I break them into 4 and I swallow. Okay, so when it gets into my system, now it has to be broken down further. Okay, to final, and then before the body absorbs it. Okay, now that is the difference between me taking the Panadol tablet that way and somebody taking syrup. The one taking the syrup, it's already fluid, okay, so it gets absorbed faster. And then the one using the suppository, it also gets absorbed faster, okay? Yeah, suppository. Yes. So it gets absorbed faster than me taking the tablet, right? So there's a short period of time within which it will start, its action will start, and after a certain period of time, the drug is broken down, and then you don't have enough amount of drug in your system to give you the same effect, okay? So you have to take another one, okay? To also give you the right quantity in the stream for the action to continue. We understand. That is why when you take one, after some time you have to take another one. So when you miss your dose, what do? You immediately take the next dose, okay? And there are some specific drugs that you have to wait till the next time for you to take the second dose before you take. And those specific ones, mostly when you are being dispensed those drugs, you are told. But generally, when you miss your dose, immediately you remember, you take your second dose and you continue subsequently, okay, as you are given. Now, some of us have the habit of, let's say I have a headache, okay, and then I take Panadol today, 3 times a day, but tomorrow I take in the morning, the afternoon, I don't feel the headache again, and I stop taking, it's fine, okay. Drugs like Panadol, you can get away with, okay. Now, there are different types of medicines, okay, for different conditions, right? So Panadol, Brufen or Mybolin, those ones are mostly called painkillers, okay, in simple terms. They are painkillers, they help reduce pain, they help reduce inflammation, they help bring our temperature down, okay, when we are warm. That one, if you take 1 day, 2 days, and you're okay, you can get away with it. How many of us know drugs called antibiotics? Okay. Now, antibiotics, what are they used for? I hear infection. Okay. So, Dr. Costa is here. Maybe he will help us. Infection, what type of infection? Bacteria. Good. This class is a very smart class. You get it. So, there are various types of infection. Dr. Costa, they've done your work for you. They are very smart students here. Yeah. So there are various types of infection, okay? So we have viral infection, we have bacterial infection, we have protozoa, we have fungal infection, okay? And all those ones come with their specific characteristics. But sometimes, or most often, mostly the viral and the bacterial infection, okay? They mostly look alike. Mostly the common flu is a typical example, okay? And most flus are viral infections, okay? And then the viral infections, they mostly are self-limiting. When we say self-limiting, they heal by themselves, okay? All you need is what? Time, a lot of hydration, and then manage the symptoms, like if the runny nose, the headache, the fever, okay, manage, and then they are self-limiting. They go. I remember my first son, Ivan, he had a lot of viral infections when he was young. He could spike, like, I remember the first time he spiked, he went like 41 degrees, like, his temperature he was on heat. And I rushed him to the hospital, and then they ran the labs, and it was a viral infection, and I just couldn't understand. And then the doctor said, "No, Beatrice, you should know better than this, okay?" And then we went to but it was just Panadol, okay? And subsequently, he will spike most often, and then we'll go to the lab, and it's a viral infection. And sometimes, as a mother, it's disheartening, okay, that your child's temperature keeps rising, and all you can give that child is what? Panadol. But indeed, that is all that the child needs, okay? What do? We mostly give what? Antibiotics in every form of infection. Every infection we give antibiotic, okay? I remember back home, people will come to me, to the house, asking for maybe antibiotics. All I have in my house is Panadol. And they don't even trust me. Or they don't believe. Sometimes they think I just don't want to give, okay? But the point I'm trying to drive home is that if it is not a bacterial infection, you do not give antibiotics, okay? Why? Any reason, anyone with an idea why we should? But it's just a medicine, right? If I give antibiotics and then it's not a bacterial infection, and then eventually he'll be fine, what's the big deal? Anyone with an idea why we shouldn't give antibiotics? Okay. Okay. Precisely so. So your immune system gets used to the antibiotics. Okay. So I always use this boxing analogy when I'm talking about antibiotics and resistance, okay? So it's like you are fighting with somebody, okay? If you fight with a person for the first time, okay, the person will know your weak points and where to punch and your weaknesses and your strength, right? So if you fight the person again, the person has an upper hand toward overcome you, right? That is the simple analogy of antibiotic resistance. So you don't have a bacterial infection, you take the drug, now you have traces of the medicine still in your system, okay? Now when the bacteria, you eventually get the infection, the bacteria is now used to the antibiotic that they have their way around it, okay? And that antibiotic cannot fight that infection, okay? And then you have to go higher antibiotics, okay? And it's a global canker, okay? There are infections in the hospital that are difficult to treat because almost every antibiotic the patient is resistant to almost every antibiotic, okay? We do something called culture and sensitivity test. They do it and no antibiotic is working, okay? And it can be a life-threatening condition, okay? So as much as possible, if we do not have bacterial infection, we do not take antibiotic. Again, about antibiotic, it's not a drug that you can take one day, the next day I'm feeling better, so I stop taking it, okay? You are in the same shoes like the one who has a viral infection and taking antibiotics. You get it. So for antibiotic, you complete the therapy. So for you taking 1 day and a half and stopping, it's like boxing with somebody and then you give the person a big blow. The person is lying on the floor. And then you, instead of you finishing the person, you are jubilating. Okay? So whilst you are jubilating, the person is regaining his or her strength, and then they will come back at you harder. Okay? So the person lying down is the infection, is the bacteria, okay? And you taking the antibiotic have taken it and then the bacteria is weakened. Instead of you to finish and then kill the bacteria, you are jubilating. So the bacteria will find ways and means to go around the antibiotic. And then when you take it again, it doesn't work. Which common antibiotics do we know or can we mention? Amoxicillin, right? Which one? Penicillin, good. Now, we all know amoxicillin, right? How many of us know augmentin? Okay, or amoxiclav, or co-amoxiclav. Yeah, they are the same drug, okay? So amoxicillin is different. Augmentin, amoxiclav, and co-amoxiclav, they are all the same drugs, okay, or medicines. Now, the difference between the two, okay? So augmentin, if you've bought the two before, you can attest to the price difference between the two. Now, augmentin is just amoxicillin plus something we call clavulanic acid. So each time you have augmentin or clavulin or any of, just look at it. Mostly the brand name is written and then it will tell you that each tablet contains 500 milligram amoxicillin and then 250 milligram clavulanic acid. Now that clavulanic acid is just to help prevent antibiotic resistance. Okay, because some bacteria have become so smart to break the ring of the, I told you every drug is a chemical, okay? So the chemical ring of the amoxicillin. So the clavulanic acid is just to stop that enzyme from breaking the amoxicillin ring. So what actually works in your system is still the amoxicillin. You get it? But because of resistance to amoxicillin, look at where we've gotten to. And back home, here is better, but back home in Ghana is terrible. Back home in Ghana, amoxicillin almost doesn't work for anybody because we have abused it so much so that we have to use augmentin and then other higher antibiotics, okay? So that is the seriousness of antibiotic abuse, okay? Also on antibiotics, now, I said that drugs are chemical substances, right? Mostly when you look at the label, they will say that store at a what? Cool, dry place. Some store in the refrigerator. Some keep away from light, okay? All those there are written there, they are not there for decoration purposes, okay? So every drug, as we said, it's a chemical, okay? And chemicals, chemists will tell us that they undergo a lot of reactions, okay? And then they can break down under certain conditions, okay? So when it's stated that keep it under 25 degrees, it means that when you store it outside that temperature for a long time, by the time you take it, you have very little amoxicillin or whatever drug in there, okay? Most of the drug would have broken down. If it's written that store away from light, it means that light will affect it, okay? So when you keep it in the light for a long time, by the time you take it, most of the drugs, they might have broken down, okay? So those temperatures or those storage instructions must be adhered to strictly, okay, as much as possible, okay. So I also forgot to mention that now we use Panadol as an example, right? And then Calpol, we all know Calpol too, right? We know that they contain the same thing, right? Yes, so the drug itself is what? Paracetamol. Okay? And then company A makes paracetamol, like I owe a pharmaceutical company, I name my Calpol. And then our sister also has a company, manufactures paracetamol, and then she names it what? Panadol. You get it? So those names, Panadol, Calpol, they are called the brand names. Okay, so sometimes when you go and here it's not that common, but back home you realize that a doctor will write a prescription, and then sometimes will write the specific brand, and then the patient will come and they will say that no, I don't like, it's not what the doctor wrote. I want exactly what the doctor wrote. Okay, sometimes it's mostly the same medicine produced by different companies. Okay, but someone will also argue that if I take Panadol, I'm okay, but if I take Calpol, I'm not comfortable. Maybe I have this dizziness or other side effects. And I'm saying here that they are all what? Paracetamol. What is the difference? Okay. So, paracetamol, again, Panadol tablet 500 milligram. It's written that it contains 500 milligram paracetamol, right? But when you weigh that tablet, it weighs more than 500 milligram. It means that what? There are other things added to make that paracetamol, okay? Paracetamol syrup, it contains paracetamol powder, but there are other things that mix the fluid, okay? Now, company A, maybe pap. We are preparing pap, right? And then the main food is the maize meal, okay? But we add water, okay, to make it. So let's say we are all supposed to add fluid, okay? So maybe I add still water, right? And then our sister adds sparkling water. Do you understand? At the end of the day, we all make pap, right? But we call all those other things the additives, okay? Some are slightly different, okay? So let's say starch. Some will use cornstarch, others will use maize starch, okay? And then maybe mama will react to cornstarch, will not react to maize starch, okay? That is why sometimes there are differences in how we react to different brands of the same medicine, okay? And lastly, I want to touch on our chronic medications, okay? Because most age comes with a lot of these chronic conditions, and then we have chronic medications like hypertension, diabetes, and all those drugs, okay? So mostly you are given one or two drugs, two or more drugs mostly, okay? And then you ask yourself, why can't let's say if I'm taking hypertension, for example, if I'm taking 5 milligram amlodipine and then 2.5 milligram maybe hydrochlorothiazide, why can't I just take one drug, amlodipine 10 milligram, and I'm done? Okay. So what happens is that most of these conditions, different things bring about these conditions. Let's take hypertension, okay? So in hypertension, the force of contraction of the heart is hard, okay? It's strong contractions. There's, how do I even explain resistance at the periphery? So in the body system, there's resistance towards, or there's some force against the pressure coming from the heart, okay? Sometimes there's excess fluid, water, okay? So some of the drugs, most of the drugs, they work on different parts of the hypertension etiology, okay, or the causes of hypertension. So some of them, like amlodipine, will slow down the contraction of the heart, right? And then the hydrochlorothiazide will excrete or take away excess fluid. Too much volume will add to the blood pressure, okay? So 2 or more, they will target different aspects of the blood pressure to help reduce the pressure, you get it? That is why research has shown that one single drug is mostly inadequate to control the blood pressure, right? So you'll be given 2 or 3, and then sometimes the dose is adjusted. They come with their complications, their side effects, and all that. All you have to do is to report, okay? Our gentlemen are here. Yes, I guess some of them will not take their BP medication because they don't do one in the other room when they take it. So, yes, there are people like that. So all you have to do is to report to your healthcare provider that this is what is happening, and then it can be given. Please don't buy those drugs by yourself without being prescribed. No, I had a patient, a family member, okay? I went home and the person brought his antihypertensive drugs. And then the person had Dr. Kosa, amlodipine and nifedipine together. He went to buy the second one. Now, these 2 drugs are in the same class, okay? And you don't take them together. You have to take one from each class or one from where it's different parts where it will act, okay? So please take it under prescription. Lastly, like diabetes as well, okay? Diabetes, mostly there are 2 types. I'll talk about this one and I'll be done. Yeah, there are 2 types. The one that mostly starts with juveniles or babies, like mostly we call it type 1. And then the type 2 that mostly is adult onset or is gotten when we grow up. So the ones that start the type 1, mostly there's no insulin at all. Now, we all know that diabetes, we say that there's high sugar, right? Blood sugar, okay? So we need the insulin to help the cells or our muscles use the glucose in our bloodstream, okay, in simple terms. So in the type 2 diabetes, mostly there's insulin. So in type 1, there's no insulin produced at all, okay, the beta cells are distracted, there's no insulin produced at all. Now in type 2, which we find in most adults, the insulin is produced mostly, but in our system, the insulin is not able to take the glucose into our cells, okay? So there's a lot of glucose, or as we say, sugar in the blood, okay? The insulin is to help the glucose move from the blood to our cells, our muscles, and then use them. So mostly the anti-diabetic drugs will help. And then, with the type 2 too, with time, even the production of the insulin reduces, okay? So mostly we'll start with drugs that will help the medicine, the glucose to be taken from the blood into the cells, right? And then with time, we'll have to add on to the ones that will help you produce more insulin because there's no insulin. For the type 1, mostly they are given insulin shots and then that's supplemented. Yeah, so you will need to be consistent and then take your medications and not decide to take this one because this one gives me headache and then this one makes me pee a lot or that, and then maybe push the other one some. If you are giving those 2 or 3, they are working together to control your blood pressure or your diabetes, okay? So you have to do well to. And then lastly, I want to say that if you are on any chronic medication, if you're on any medication, let your prescriber know, whether it's the pharmacist, the doctor, or let them know before they give you any other medication, okay? We have something we call drug interactions, okay? That when you take drug A and then drug B together, they will form something that will cause chaos in your system, you get it? So sometimes when you are taking 2 drugs, your prescriber or dispenser will tell you that take this one, after 2 hours you take the other one, okay? So it is important that you let your prescriber know which drugs you are on before they add on. Because some drugs, we call something we call contraindications. I'm sure you've seen them on your drug leaflet, okay? Contraindication means that when you have that condition, when you have that condition, you shouldn't take that drug at all. So let's say if you are taking drug A, you shouldn't take drug B in addition, okay? Like they are contraindicated. So it is important to let your prescriber or your dispenser know if you are on any medication so that the medicines can be of good use. Yeah, thank you so much, Ma'am.